I wanted to talk about the importance of nursing home screening and present to you three different cases. And these cases are all unique, but there are also a lot of similarities. And interestingly, in all of these nursing home cases, they involved a nursing home that was close to a large metropolitan area. The first case is a nursing home within King County, Washington. There was a COVID-19 positive long-term care staff member, and at this point, the CDC was working with the facility, and they did symptom assessments as well as viral testing of residents. So they used both of those screening measures. The residents were categorized, as asymptomatic or symptomatic. And when they looked at the residents with positive tests, 30% of them had positive tests, 43% of them had symptoms on the day of testing, and then 57% were asymptomatic. So the take-home message when we're looking at this case is that if you're using just symptom-based screening, you're really going to fail to identify many of those that could very well have COVID. So this is a case where it really shows us the importance of doing those testing screenings. The second case involves several long-term care facilities in Fulton County, Georgia. And this is near Atlanta, Georgia, which is a very populated area and had quite a bit of COVID-19 activity within that community in spring and summer. So they were actually this case was looking at the difference between facility-wide testing in response to positive cases within the facility, and then facilities that were using testing as a prevention strategy before any cases were identified. And as you can see there, the numbers on the screen, the facilities that were using it in response to having a positive COVID-19 case had a much higher prevalence of additional cases in residents and staff that were found at initial testing, and then at follow-up testing, they still had that high prevalence. Now, when you compare that to the facilities that were using it as a preventive strategy, these facilities had a much lower prevalence of residents and staff that tested positive, both initially and at follow-up. So when I'm looking at this case, the take-home message really is preventive screening is much more effective when we're thinking about preventing and managing COVID-19 infections in the long-term care facility. And then finally, this screening case has to do with a facility that was in the western part of France. And it's actually a retrospective observational study. And they looked at this nursing home that actually had a very high mortality rate related to COVID-19. I believe it was 27%. And they were really looking back in time to describe the COVID-19 symptoms that they retrospectively found that the residents and the staff had. And when they looked at the positivity rate in the facilities, 47% of the residents were positive and 24% of the staff were positive. So this was really widespread within this facility. And when they looked at the findings, looking again retrospectively at symptoms, they found that the residents had both general as well as respiratory signs of COVID-19, but they also had this in combination with geriatric syndromes, and specifically falls and confusion. They also found that the older residents, and they defined that as an age greater than 90, they had fewer and more non-specific symptoms, which of course is very problematic because symptoms are really what get us to notice if somebody is sick.